we're really excited to present the results of the ROAR, Resiliency Among Older Adults Receiving Lung Cancer Treatment. This was a Phase II randomized clinical trial that was a supportive care intervention that randomized patients to either getting standard of care physical therapy compared to the ROAR intervention group, which was a combination of in-person and virtual health physical therapy. So older adults in particular have a lot of access barriers to coming to the medical center, whether it's driving, parking, multiple trips can be a huge barrier for older adults. Maybe they don't want to drive or they're not feeling well. So access to improving their physical functioning can be a huge issue, at least at diagnosis or even after treatment has started. So in the ROAR intervention group, we were able to we had 100 participants, randomize them to one of two groups, and we had 100% of our patients who started the ROAR intervention were able to interact with physical therapy, whereas less than half were able to do that in the standard of care group. And then at the end of the study, so our patients, we wanted to make sure at least half of them would do at least 8 of the physical therapy sessions or more. And we found that 63% of them were able to complete 8 or more of the sessions. And again, it was in person and using virtual health. So patients were able to participate in the comfort of their own home. And we were able to do this safely. So 30% of our participants were actually living in rural zip codes in Ohio, which is in the center of the United States where we conducted this study. And we found significant improvements in an objective measurement of physical function, but also in subjective fatigue. So 20% of the participants, we saw a 20% improvement in fatigue actually at the end of the intervention, which is really meaningful for older adults because fatigue can be a really important cause of functional disability.